Headache is the most common symptom after a concussion. Sometimes it appears immediately after the concussion, but other times it starts after hours or days. The treatment of headaches after concussion is different from a regular headache. This is the third video of a 4-part series. In the first video, I talked about how doctors make the diagnosis of concussion. In the second video, I explained when the person can return to exercises and return to sports. So let's talk about concussion and headaches today. Headache after concussion is related to a sensitivity of the trigeminal nerve. We have this trigeminal nerve, which is basically a sensory nerve that brings billions of neurons from the face and head to the brain. During a concussion, there are some areas that are injured, and then the trigeminal nerve will transmit that message to the brain. One of the areas that get injured during a concussion are the meninges. The meninges are the membranes that cover the brain. They are like the skin of this apple. There is a second mechanism how headaches produce after a concussion, and this is when the top-down inhibitory painkillers are not working properly. Our pain system has a bottom-up and a top-down highway. The bottom-up is where the electrical signals from the periphery reach the brain. The top-down is the response to pain. It is when the brain reacts to the sensations that arrive from the bottom-up highway. We have a fantastic, powerful top-down system that is able to totally suppress any sensation, including pain. However, this top-down system may also get injured during a concussion, and then the brain loses the ability to suppress the painful sensations that the trigeminal nerve is bringing to the brain. So now the bottom up is super active. There are a lot of electrical signals traveling through the trigeminal nerve upwards, and the top-down system is kind of deficient. It is malfunctioning. So the person will feel headache, constant, it's very annoying and hard to control with regular painkillers. In some people, this headache can persist for days or weeks or months, and that's because this vicious cycle of inflammation activates the trigeminal nerve, the brainstem is unable to block the painful sensations, and this causes more headaches. When the symptoms of a concussion last longer than 3 months, this is because the pain is becoming chronic. There are nociplastic changes in the pain pathways, and this is called post-concussion syndrome or PCS. Post-concussion headaches are very intense, and we need to treat them aggressively, so the brain will not get used to processing pain all the time and develop nociplastic pain. In terms of medications, we can use non-steroidal anti-inflammatory to treat headaches. The person just needs to be assessed by a physician to make sure that they don't have any risks of bleeding or any contraindication to take NSAIDs. Watch my other video about NSAIDs where I explained various types of NSAIDs and what are the contraindications for each of them. The person needs to be careful not to use NSAIDs daily, as this could cause another type of headache, which is called medication overuse headaches or rebound headaches. Rebound headaches also occur with other types of painkillers, like opioids and triptans. What can the person do instead of a pill or a medication? There are self-management techniques. Apply a cold or hot pack to the head or neck. Tie something tight around the head. Stretching and self-massaging the head or the neck or shoulders. Perform breathing exercises, visualization or other mindfulness-based exercises. Go to a quiet place, lie down, go outside to get fresh air. Stress management. We know that stress and anxiety also make the headaches a lot worse. And that is because the sympathetic nervous system gets activated and releases adrenaline and cortisol. These substances may aggravate the headaches. So any measure to reduce the anxiety and stress will end up also alleviating the headaches. Here are some examples: meditation, mindfulness, somatic tracking, and watch my other video that I have on my channel, breathing relaxation, vagus nerve exercises, slow movements, taking a bath, massage, acupuncture, and the assistance of an occupational therapist, psychologist, or GP psychotherapist or psychiatrist may be necessary. What about meals? The person may also notice that eating nutritional meals have a huge impact on their well-being. The gut bacteria need a lot of fiber, and the gut bacteria really help to reduce painful signals to the brain. So feed those bacteria with fruits. Keep the skins of vegetables, fruits, eat beans, green leaves, and yogurt. Talking about fruit with skin, this apple looks delicious. It is well known that skipping or delaying meals can trigger headaches in some people. Try to consume breakfast, ideally a high-protein breakfast, lunch and dinner, and avoid delaying or skipping meals. Hydration. It is thought that dehydration can be a trigger for headaches in some susceptible individuals. As such, it is important to maintain good hydration. This means consuming 4 to 6 drinks per day of water, juice, milk, or other non-caffeinated beverages. Regular daily caffeine consumption, coffee, soft drinks, should be avoided, as caffeine consumption and withdrawals can precipitate headaches. However, when an individual does not consume caffeinated beverages regularly, a caffeinated beverage may be helpful to minimize intermittent bad headaches. Diet soft drinks should be further avoided, as in some aspartame may trigger headaches. What about exercises? In the initial period after a traumatic brain injury, physical rest is often endorsed. However, as the weeks go by, inactivity and frequently counterproductive in a sedentary lifestyle without any cardiovascular exercise may some perpetuate the headaches. So accordingly, a brisk walk, particularly a morning walk outside, riding on a stationary bike, walking or jogging on a treadmill or elliptical machine, or swimming can be very helpful in headache management. An exercise program should be undertaken as tolerated, with gradually increasing duration and intensity. For some people, exercise triggers a headache, and in these individuals, the intensity and or duration of the exercise should be reduced, or an alternative exercise should be trialed. Sleep. Don't forget that sleep is also essential for the brain to recover. Do not sleep too little or too much. Try to sleep between 7 and 9 hours in a dark place. Go to bed and wake up at the same time every day. Avoid taking long naps in the middle of the day, not more than 15 to 30 minutes, and do not nap every day, so your body will not get used to it. I made this video in collaboration with Concussion Legacy Foundation, a charity organization based in the US with chapters in Australia, Canada, and the UK. If you want to check their resources, visit the website concussionfoundation.org. And remember, this video is not medical advice. If you think you have a concussion, please talk to a healthcare professional. If there is an emergency, please go to the nearest emergency department or call an ambulance. And this video is for educational purposes only. Share this video with anyone that might need this information. Thank you for watching. Goodbye.